you guys a shout out for the live podcast version. Okay, one more time. TikTok live number 33. It's on now. We're live. First question was asked. This is a comment from Surgeon Bergen. Hey, I enjoy your content. Just scrolling through. Surgeon Bergen, thank you. Likewise, friend. Good stuff. Thanks for stopping by. Say hello. L_LLL. Did you know you want to do dentistry when you entered college? Actually, I didn't. I did not know I wanted to do dentistry or oral surgery for that matter. I was initially thinking medical school, maybe PA. My aunt, one of my awesome aunts, she's a PA, and I thought what she did was awesome, vascular surgery. I shouted one of the vascular surgeons that she knows, and then I shouted a couple dentists I knew from the gym, and I really felt that oral surgery was the one. I felt that dentistry was the one, and I knew that oral surgery had a big interest for oral surgery as well. So that's how that went. But what's going on, friends? Let's get some comments in here. Let's get some comments going. It's live. Top 3 listeners, I'll be giving you a shout out on when I post the podcast, the full version on YouTube channel and podcasts, all the podcast platforms, and it'll be TikTok live number 43. Aric Gordon, Duriel said, you got some haters a couple of vids back. I got some, you saw that, right? I got some serious haters. By the way, like, just to clarify, the cutoff, no one takes out teeth with a diastolic blood pressure over 100. Like, even if you're nervous, if you have a normal blood pressure on the day-to-day basis, 120/80, and you're really nervous with lots of anxiety, your blood pressure is not going up over 100. And with tooth pain, that's not going to get you over a diastolic of 100 multiple times one after another. We don't take out teeth like that. So, yeah, a lot of haters. But just so everyone knows now, on the medical side, yeah, we don't take out teeth when your diastolic's over 100. And I'm not saying I'm necessarily sending someone to the emergency department. That is not what I said in that video. All I'm saying is we need that blood pressure to be generally under control before we do any type of invasive surgery or dental procedure. That matter. I know a lot of people on the medical side like to condescend and minimize dentistry, and you could do that all you want, but the fact is, in dentistry, we do not take out teeth with a diastolic over 100. Okay? All right? Now you know. Jesus. All right, Aric Gordon, how do you keep festive and the spirits up for the patients? Well, if it gets busy, sometimes you're like going from one to another. It gets hectic, right? But that was fun. Everyone wants to, and, I try to like make it optimistic. So I'm like, well, we'll get this tooth out before the holidays, right? So you don't have to have this same pain. You might have some discomfort after the tooth comes out, for example, right? But at least you won't have that kind of tooth pain for the holidays, this week, next week coming up. You try here and there. Many times, like today, I'm helping out in the urgent care clinic, and it's just one after another, So I'm not always in such deep conversation. I'm coming in bailing out dental students with teeth here and there, broken down teeth, stuff like that. eDog580, what dental school did you go to? I went to Stony Brook Dental School. That's out on Long Island in New York. Dennis said trying to get into OMFS. What dental school did you go to? I went to Stony Brook Dental School on Long Island in New York. So it's a small class size. My class size was 44 students, and in my year, we placed 4 into oral surgery. So that's a good percentage, compared to most dental schools in the United States. Sure, you have Columbia, you got Harvard, UPenn. They all place a lot. UConn does pretty well year after year, placing dental students into specialties. So, yeah. Dola.17, is surgery fun? Yeah, dude, surgery is a lot of fun. I do like taking out teeth, complicated teeth. It's fun when you could get out a very difficult tooth to take out. Trauma surgery I like as well. It's like a puzzle. You get broken bones, you got to put them back together, and you got to put it back together so that, the cosmetics are hopefully right, but even more important, the functionality of, say, your jaw, for example, right? You got to be able to speak and chew, and there are implications if you don't do it correctly. You could have worsening TMJ pain, or you have no TMJ pain, and now you do, among a number of other things. L_LLL said, anything you recommend to reverse cavities? Brushing your teeth and with fluoride toothpaste. It's funny because there's this controversy with the fluoride now, and it's like, don't swallow are you swallowing your toothpaste? Probably not, right? I hope not. You're not supposed to swallow your toothpaste. If you're brushing your teeth with toothpaste, toothpaste with fluoride for 2 to 3 minutes, right? And you spit it out, you're not swallowing enough toothpaste with fluoride in it to cause harm, right? So that's generally the thought process behind it. Dr. Leo? Yeah, no, Dr. Leith.al. Hey, doctor, just graduated. When should I specialize in OS? Not OMFS, just OS for XLA, etc. Well, I'm not sure. In the United States, it is OMFS. It's not just OS. So I'm not really sure what you mean. I don't know how to pronounce it. Hey, doc, do OMS that focus on head and neck surgery have PAs in clinical settings, or is it usually dental assistants? I believe it head and neck. No, that's PAs. Eating My Chips said, is it possible to start studying for the CBSE before starting dental school? Is it possible? Yeah. Is it going to go well and is it efficient? No, you're really just better off waiting until during or after D1 year before you really start to hone in on CBSE studying material. Dullah.17 is surgery funds. Yep. Ari Winky Face. Any operating restrictions if a patient has a BGL of like, I think you're saying like you meant to say BMI of like 300 or oh no, BMI is not going to be 300. Yeah, there are definitely operating restrictions, more so for IV sedation. For IV sedation, you want to be very conscientious of someone's airway. So like we look at the Mallampati score, we look at the Brodsky score sometimes, and the overall BMI of the patient. You want to make sure that that airway is going to be protected and safe for, active breathing through the sedation. User 74728, where do you go for undergrad? I did 2 years at NYU Poly. That's now NYU Tannen School of Engineering. And then I did my latter 2 years where I graduated from with Stevens Institute of Technology in Hoboken, New Jersey. Kayar Venom said, any advice for pre-dent taking DAT in 2 months? Yeah, dude, study hard. Spend all this time, spend this break that you have in between your semesters right now, your winter breaks, study as much as you can right now. Get that out of the way. Good luck. He said, do you think OMFS is getting more and more or less competitive to get into? Well, it really depends. It changes all the time. It really depends on your scores. They're taking the same top percentage of residents, it seems like now, and that's leaving, like last year, there were 26 unmatched spots in oral surgeries. It's really, it varies year after year, but it looks like they're all, most of the programs are taking the same top applicants year after year. And then there's going to be a gap, and the bottom, like the less high, how do I phrase this, are not getting in. Azuzi 31.313. Do you find the job loses more of the social aspect as you specialize into surgery? No. It really doesn't. It really doesn't. You can make the argument that, when you're a general dentist, you see someone like every 3 to 6 months or a year, which is true, right? But when you're in oral surgery, you're just meeting people for the first time. You still want to converse with them, get them comfortable and such. So yes or no? Ron Butler said Alveo. What about it? Junior HLOVR said, where'd it go? Are you working on Christmas? I actually just found out a couple days ago I'm not working on Christmas. I am working tomorrow on Christmas Eve, though, and on New Year's Eve, but not working New Year's Day. Eating My Chips. Kayar Venom. Does DAT booster? I got a 23. That sounds pretty good. Lisa T said, writing my personal statement for dental school right now. Any tips? Yeah, make it almost like a conversation where you're telling a story, and it should flow from start to finish. That's important. I know that's like a general thing, but like you're kind of telling a story about your life of where you're giving a background about yourself that's relatable. You want to be relatable to the reader, just like on an interview. You want to be relatable to the interviewer, and then you want to be able to explain your experiences and how that relates to bottom line you're applying to dental school for oral surgery, right? And Jelly said, should I extract a tooth that has an infected root canal, doc? That's up to you, right? That's not necessarily up to me. It's up to the general dentist on that stuff. User 717, why OMFS? Because it's awesome. It's the surgical specialty of dentistry. It is a bridge between the medicine and dental side of healthcare. We do a lot of invasive surgery everywhere from cancer to trauma to orthognathic surgery to correct skeletal deformities of the facial region, right? Dental facial deformities, all the way to extraction of teeth, sedations. It's awesome. Other specialties in oral surgery can't do all those things. Sapphire Mirrors, I'm going to have LJS next year. All right. Congrats. Good luck. That's a big step. Student Dr. Eli left an emoji. What's up, Eli? He left the emoji. C. Benji, what's up, C. Benji? Said, how did you get clinical experience in undergrad? You don't really get clinical experience in undergrad. I mean, you could be an EMT, you could be, I was a lifeguard. Lifeguarding was awesome because you could study while you're at work. If you're at like a 4-foot deep pool, like I was at the gym, no one's drowning that, right? Unless something catastrophic happens, it's kind of like, all right, put your feet down. You're going to be okay. They said, sorry for the name. I'm the same kid that asks you things on Insta. The name is Akif. What's up, Akif? Aric Gordon says, what's the drink of the night? Oh, I don't know. I'm probably a winter ale, maybe a port, probably a stout, actually. I'm meeting a buddy out in a little bit for dinner at Printer's Alley. So we'll see what they got on tap there. I'm thinking it's cold out. It's like 19 degrees, maybe even less. I think it was between 10 and 20 when I went out this morning. It was 9 degrees. Kayar Venom, follow the live creator. Thank you. Sapphire Mirrors, follow the live creator. Thanks, Sapphire. User 735, I will be attending ULSD this August. I really want to specialize OMS. Is this a good route? That's a good route. Oh, yeah. San Diego, right? That's a good one. Student Dr. Eli, congrats on matching to ortho. Said Lisa T. I watch your YouTube videos. Awesome. And congrats, Doctor. Congrats, Eli, matching to ortho. Well done. Well done. What was one of your, the name Keith, what was one of your biggest challenges going through dental school along with residency? Biggest challenge of residency is really just making sure you get enough time for yourself. Rest, exercise, family, friends, stuff like that. Making sure you're staying healthy there early on in the beginning. Dental school, it was, for me, the academic side was tougher. Clinical side, I flew. I found that I needed a lot less repetitions on the clinical side, the hand skill side, and I need more repetitions, I think, on it. Or maybe it seemed like everyone was studying less. They were hiding it. They were studying just as much. But academically, it took me a while to find out that Quizlet was like my to learning things. I just put in, I'm studying for the boards in 2.5 weeks now. I just put all the materials that I'm going to study into Quizlet with figures. I make a question and answer, and I'm going to be studying that up until the board exam. That was my hack. All right, friends, 6:32. I got to go. Couple more questions, and then I got to go. Lisa, thanks. Appreciate you. Student Dr. Eli, shout out to you, Eli. Getting into ortho. Well done. Juan Dan Reyes, I have a 3.5 overall GPA undergrad. Should I do a postback or should I be fine? I can't tell you if it's going to be fine. I don't know the rest of your application or resume, right? Go for it, and I think you'll find out what you need to do. Do both, but go all in on that, all right? I also don't know what your DAT score is. That's going to be big too. All right, friends, the top 3 listeners, I'm going to be giving you guys a shout out in the caption on YouTube channel and podcast in the caption, so give that a check out. This is TikTok Live number 33. TikTok Live number 43. Merry Christmas, everyone. In 2 days, tomorrow's Christmas Eve. Love you guys. Thanks for coming on. You're my podcast family. I appreciate you more than you know. You're my family, all right? And I'm here for you. Any questions you have, just ask. Hit me up on Instagram. I get back to you as quick as I can in the DM, and we'll chat. All right, friends. Happy holidays. Be safe. Be smart. And get some rest. All right. Love you guys. Good night.